Good afternoon, everyone. It is truly a pleasure and honor to be here today to present Hypertensive Urgency, a quality improvement project and clinical care pathway of least resistance. Patients with elevated blood pressure, particularly hypertensive urgency, present frequently to hospital. There are studies that show patients with hypertensive urgency managed as an outpatient have a low risk of adverse events. However, despite this, patients are frequently referred to the emergency department for admission. In Toronto, a Gemini study showed that hypertension is one of the most common short stay admissions to hospital. Unfortunately, short stay admissions are not the most efficient use of hospital and system resources, and therefore, many hospital strategic plans are hoping to bring more opportunities to the outpatient experience. Therefore, the goal of this project is to create a standardized multidisciplinary care pathway for the outpatient management of hypertensive urgency. At this time, we are retrospectively collecting demographic and outcome measures for patients who come to the GIM clinic with hypertensive urgency. We are actively seeing and managing patients, but our current sample includes 11 clinic referrals. Thus far, 36% of patients were referred from the emergency department, 55 were referred post-discharge, and 9% from a family physician's office, as shown in Figure 2. Of the patients referred to clinic, so far the patients are older, mostly female, commonly with comorbidities such as diabetes, and their average blood pressure on presentation is quite high at 197/105 average, as shown in Figure 3. Already, the clinic has shown some preliminary outcomes that are encouraging. In Figure 4, the blue line demonstrates the average systolic blood pressure on presentation to clinic, which was reduced with pharmacologic and lifestyle approaches at the 30-day follow-up, as shown in the red line. Further, none of these patients visited the emergency department, died, or were readmitted within 30 days. While it is becoming increasingly clear that managing patients with hypertensive urgency in the outpatient setting is safe, we have identified a number of gaps in the care of these patients, as shown in Figure 1. To understand the root cause of these gaps, key stakeholders were identified, as shown in Figure 5. Focus groups are now trying to develop standardized protocols for the appropriate investigations and treatment in the emergency department and clinic, the appropriate admission criteria, and the appropriate patient educational materials. To ensure that there are, in fact, improvements made with our intervention, we have outcome process and balancing measures in place. Please see Table 1 for further description of these measures. Ultimately, using the model for improvement, we aim to reduce admissions to GIM at Toronto Western Hospital for hypertensive urgency by 25% by July of 2022. The multifaceted interventions for this project will be developed and implemented iteratively, and we are hopeful that we can improve the patient experience, provide safe and evidence-informed care, and reduce unnecessary emergency department visits or admissions to hospital. And with that, we can achieve the path of least resistance.